Hi.
Welcome to Lunch with the Doc. It's the day before Thanksgiving, the holiday cheer is out and about around town, and we're down here at Tommy, Bahamas, ready for another Lunch with the Doc.
I love this. We get to eat at great restaurants every single week and feature their menus and their great servers. Now look at him. Introduce yourself.
Hi, how are you? I'm Junior.
Hi, Junior.
How are you?
And they already have all of their Christmas decorations up. It's lovely.
Yeah, we just put
So
them up today.
festive.
Yeah.
Junior has
Festive.
served us flat water, nice filtered water.
Amazing.
So we're good. We're looking at the menu. Of course, I'm still going to go with the gluten-free because
Always.
Yep. You guys know what you want?
I know, I still need like a little
I'm going to go with the
side.
barbacoa tacos, lettuce wrap, gluten-free.
I'm gonna just take a minute.
Do the chicken mango salad.
Chicken.
Chicken mango salad. They're ahead of me. I haven't had a chance to look at this menu yet.
You know what we're going to do while she's going, we're just going to wrap up the whiplash series. I'm Dr. Gary Arthur, by the way, Doctor of Chiropractic, Laguna Beach, and just finishing up my naturopathic. I hope to get it done by the end of this year. That will be a big milestone. And also, we're going to talk about, let's say, for example, you haven't treated a whiplash appropriately. Let's say you've had a head trauma or neck trauma earlier in your life.
Is this one good?
You fell off the diaper changing table,
Okay.
fell down the stairs, dove into the bottom of the swimming pool,
We could take out like the.
maybe had a car accident,
Okay.
fell off your bike.
I'll get that. I got the ahi poke bowl. Perfect.
Awesome. Thank you. Maybe you fell off the slide. Maybe you fell off the swing. Maybe you fell off those merry-go-rounds in the park. Maybe you had a toboggan accident or fell ice skating, snow skiing, water skiing. Maybe your brother came up from behind you and your other brother pushed you from behind and you fell back over him and landed on your neck. All kinds of different options.
Lots of options.
Maybe you went head first into the handball wall like I did.
Ooh, that doesn't sound fun.
There's so many.
So many stories. I'm trying to think what was one of my worst injuries
Neck head
ever.
trauma.
Yeah.
My son.
Yeah,
go ahead.
yes. One Easter, I might have shared this on our past Lunch with the Doc, but one Easter we were having our famous, Easter egg hunt. There was the one big Easter egg that everybody wanted to get, and I was out there just ready to find it.
Golden
And so
Easter
was
egg.
the golden Easter egg, exactly.
The one with the money in
The
it.
one with the money in it. And Raya, my brother, was quite competitive, wanting to get things done as well, just like me. So he decides to jump off our porch over the balcony and down onto the grass below. Little did he know that me in my little Easter dress was down there with my Easter basket, just running by, ready to get my Easter eggs, and he landed right on my head
Oh.
from the balcony above. That was a big injury.
We've all got our stories.
We do.
We've all been injured. And just to quickly recap, remember how we talked about after any injury, whether it's a fall on your butt, whatever, you have 3 days of inflammation,
On your butt.
whatever. And then your body starts laying down scar tissue on the 5th day, and it lays down this meshwork of scar tissue for the next 12 weeks. That's called the repair stage. That's why it's so important when you get any kind of injury, make sure you heal with motion. Because if you don't have motion while it's healing, you're going to end up with a very dense wad of scar tissue, which is basically kind of like gristle in meat or steak. And it makes it so that if that heals with all that bristly tight tissue around it, then it's not going to move very much, and then it's going to be prone to osteoarthritis and degeneration and chronic pain. So we've all got our stories. California OSHA did a study. They found that the average little boy, by the time he reached his 6th birthday, had 200 significant traumas. So that's about one every 10 days. But you think about it, from an infant all the way through, if they had a big brother, they probably had more than that. They did say older brothers helped them get more than that. So we've all got our stories, and then injury after injury, scar tissue after scar tissue, and our posture gets distorted. And what they found is that if you get distorted posture, a famous doctor got a Nobel Prize for this, and what he found was that the brain is a generator of electrical activity, and this was on brain research, and he found 90% of the energy of the brain is used in the body just to relate us to gravity. Only 10% has to do with healing and organ function and thinking and stress and all that. Only 10%.
Wow.
And that's if you have normal posture. So if you have a distortion, that means you're going to rob part of the precious 10% just to cope with the distortion of your posture. And where the distortion of the posture is going to age prematurely because gravity's pushing down at 32 pounds per square inch. So the human frame is designed to withstand gravity and not prematurely age. But we can see wherever the distortions are from the old injuries and how it healed. That's the area that starts to show disc degeneration and bone spurring and the advancement of osteoarthritis. That's why it's so important. I just want to encourage you, fix your posture. Find out how your posture is. Not only will you feel better and be healthier, but you'll look a lot better too. I mean, some people think postures like that are kind of good looking, but I don't know too many. You know, get your posture fixed. Be straight-headed, be level-shouldered, chest back, your chest up, head back. Yeah,
just like
posture.
a ballerina.
Good posture is good. We always notice in other people go, whoa, that person has bad posture. But then sometimes we don't realize that we have it. So that's easy to get checked. We do a postural analysis for people. We also take state-of-the-art postural x-rays so you can exactly find out if your posture does have a distortion, where it is, and then you can figure out what to do about it so you fix it. And it's so proactive. And then really it comes down to value, your value of your quality of life and where your quality of life's going from here on. So if you want to live pain-free, if you want to be as healthy as possible, you fix your posture, you restore your body back to normal, and then you get to enjoy the body working well and not living in chronic pain and getting knee replacements and hip replacements and surgeries of your spine and chronic pain syndromes and headaches and all this stuff. A lot of it can be fixed when you fix your posture.
Good.
So now.
So, we did, our first week on whiplash was kind of like how you prevent whiplash, so giving you some tools for that. Our second week was what happens right when you get whiplash and what can you do in the very moments after that to help. Now today we're going to talk a little bit about the details of what does treatment look like for that whiplash and what does your recovery look like. So Dr. Gary's going to give us some details on some of the techniques we use to heal whiplash specifically.
Yeah, and I also want to address the people who've had earlier traumas and have never fixed them before. Maybe they just didn't know how. So once we get the new patient in that's had a whiplash, we basically have to make sure that there aren't spinal injuries that are very dangerous. So sometimes we have to take an MRI to rule out a disc problem. Sometimes we almost always will take postural x-rays that actually bend the head forward and backwards to see if the spinal ligaments have been torn. If they have been torn or you have a whiplash, anytime you're in a car after that, you have to wear a collar for about the next 6 weeks. Because a double whiplash, if you've already got ligament instability in your neck or muscular instability in your neck, and you get a second whiplash, that could be a very, very serious injury. So that's what we determine in your exam and the x-rays. And then we put together a plan of care. Usually it's 12 weeks because that's how long it takes for the repair stage to happen. And we give patients exercises. We do deep tissue massage. We do tissue work to make sure that the scar tissue doesn't get thick. And we do gentle mobilizations and adjustments and exercises and all those kind of things. We often give Traumeel, which is topical homeopathic remedies. We give arnica internally. We give people magnesium and fish oils for inflammation and muscle spasm. And then we just try to get people well as quickly as possible. Sometimes people don't require 12 weeks of treatment. So the sooner we get people well, the better it is. And we also talked last time, make sure that you get med pay on your insurance. So if you are injured, you can go to a chiropractor or someone that you trust and get the care you need without having to pay for the care yourself. So it doesn't cost very much to get med pay on your insurance. Call your insurance provider. You'll wish you had listened to me. If you get in an accident and you don't have it, then it's a whole different ballgame. So what do you think about talking about the people that have had those traumas and didn't treat them?
Yeah.
That was me.
It was him.
Because I only got 5 treatments or so, and then I signed on the dotted line.
Hindsight is 20/20.
I don't need any more care. I want money for my car and my sailboat. So 5 years later is when I actually did the work. I had chronic pain in the neck, chronic pain in the back, mid-back, and chronic sinus problems. And the chiropractor took x-rays of me and says, wow, look like you've had an accident before. Whiplash. And he said, have you had one? I said, yeah. He says, well, why didn't you write it down here? I go, I just didn't. I wanted to see what you'd say. So I didn't really trust chiropractors. And, excuse me. And I don't know why. I think it was, just programming that chiropractic was something weird. But chiro basically means done with a hand. It's treatment that's done with hands. That's all it is. The Chinese doctors have been doing their version of chiropractic for 3,000 years. Theirs is called Tui Na. They adjust the spine, and so it's nothing foreign. It's just the drug companies don't like people that do things with their hands that get people well without drugs. So, that's just the reality. Isn't she cute?
Oh.
The daughter.
Wow.
My second daughter. And can I have that for a second? Come on, Wonder Woman.
We gotta show the camera girl.
Come on. Gotta show the camera girl. There you go. That's my first daughter. That's Arya Star, a.k.a. Wonder Woman.
AKA Wonder Woman. She is. She's a Wonder Woman at the front desk and on the balance.
Yeah.
She knows what's up. She's got it all handled.
Hey, what's going on December 1st?
We are having our 30-year anniversary, so you're welcome.
Our wedding anniversary?
Our 30-year Health and Balance anniversary.
So 30 years in practice.
Yes.
Oh.
And we're having free treatment for anybody in the community to come. We're giving free B12 shots, adjustments, and therapy. We'll have food, and so that's from 8 to 2. And then from 2 to 5, we're having a 30-year anniversry party. Skipper Korea will be there. Dr. Garrett will be singing. There'll be some food.
Skipper and I are going to sing at 2:30, 3:30, and 4:30.
Yeah.
Yeah.
So you guys should come. It's going to be a great day.
We have beverages, wine,
And then
beer. Maybe
After that, it's hospitality night. So it's just a perfect pre-party to hospitality night. So there you go.
What's that newscaster that everybody says you look like?
Aaron Burnett.
Aaron Burnett? Yeah, I think you're prettier, but I see the resemblance.
Thank you. All right, back to you guys.
Thanks, Art.
Back
Put her
to
right on the spot, didn't they?
Yeah, so next Friday, big, exciting things. We're just adding to the holiday joy. I mean, there's so much holiday celebration and joy going on.
Weird that we
Just
do that.
weird. I mean, come on. So we got a Thanksgiving tomorrow, 30th anniversary party next Friday.
I did work on an undergraduate PhD. Now that's a weird thing to think about. Isn't it? Yeah. It was it was an undergraduate PhD program in FUN. So I got a doctorate of fun while I was going to school before I graduated. Maybe some of you did that too.
Oh, maybe. Yeah. I think I did that.
A little bit of that. Okay.
Yeah, a little bit of that.
So, anyhow, call. New patients can come in that day.
Yes.
Old patients can come in that day. Free treatment. Just call in advance and we'll reserve a time for you. I'd love to see you between 8 and 2. Just call 497-2553 and just find a time and we'd love to see you and give you a little body love.
Yeah.
Okay? Now, what were you going to say?
No, you go.
All right.
You're talking about whiplash
So how to
patients.
fix it. So now let's say you were like me, you didn't get the care you needed, and you suffer from chronic pain, or someone tells you you have a high shoulder, neck pain, mid back pain, low back pain, headaches, fatigue, all those kind of things, here's the simplicity, right? If you want to fix your body, you got to do the work. But you need to know what kind of work needs to be done. That's called a basic exam. That's what we do. We'll check your posture, we'll check all the orthopedics, all the neurologicals, check your range of motion, take postural films, and then from there we can actually sit down with you and help you do whatever you feel like you want to do, because these things, these challenges, end up affecting our quality of life. And that affects our future and how much fun we have and how much fun we are to be around, because it may not be that you want to do the work, but someone that you love and care about that has to deal with you not being as happy as you could be, or having to deal with chronic pain. Maybe you should do it for them. Maybe you should get checked out so they have a better life because you love them that much. Something to think about.
That is something to think about.
And it's pretty simple. Once we get that data, we find out where your scar tissue is, then we put together a simple plan of care, and it's really two parts. We don't accept every patient that comes to us, only the ones that are really serious about getting well and getting well quick. So we put together a two-part approach. These are like gears, okay? One is your part. You got to drink your water, you got to do your exercise, you got to show up and get the care you need. Simple. Number two is getting the right care that's going to actually move your body along. You put those things together and your body will get well. And we can actually measure your progress.
Beautiful. Thank you.
Of course, you're welcome.
Thank
And we
you.
have the ahi poke bowl for you.
Love it. Thank you so
And this soy
much.
dressing does have gluten in it.
Okay.
Is that going to be okay for you?
I am gluten-free. Do you have
Okay.
just any like gluten-free soy sauce?
I can do no gluten-free soy
Okay.
sauce. We can do like our mild lemon vinaigrette.
Okay.
Salad.
Sure.
That'd be an excellent choice. for
Yeah,
you.
thank
Lovely.
you.
And fresh pepper today?
Sure, that'd be great.
Thank you.
Thank you so much.
Beautiful.
Wonderful. Thank
Fresh
you.
pepper for you?
Sure. Yeah.
Perfect.
Amazing.
Lovely. That's great.
Everyone enjoy it.
Thank
We
you.
will.
You're
Thanks.
welcome.
So you can show this awesome food.
Yes, show the beautiful ahi poke bowl.
Barbacoa tacos, lettuce wrapped.
Awesome. And then we got the
Amazing.
mango chicken salad.
Beauteous. Oh, love it.
So anyhow, it's pretty darn simple. If you can figure out why you want to get better, what that's going to mean to your future, you don't want to get worse. That's the only reason I did the work, because I didn't want to continue getting worse, right? Pain is twice as much of a motivator as pleasure. So if you think about what's going to happen if you don't do the work on your body, you think it's going to get completely better on its own?
No,
Why is that?
because
I'll fill in the blank.
Okay.
Gravity doesn't let up on anyone.
Oh. There we go.
It doesn't let up on anybody. So your distortions, your pain, your problems are all going to get worse if you don't do something. So that's what I did when I was 27. I just did the work. It took me 9 months, and then it was done. And you can see my pre and post x-rays from a whiplash patient who didn't do anything about it, suffering, and then 9 months later, completely fixed. And then now, 32 years later, still completely fixed and not having any of those problems that I had a long time ago. So your why has to be big enough. You got to value your quality of life enough to do anything about it. I just invite you, come take a look, see what you can do, see what we can do to help you, and we'd love to do that. We'd be honored to see if we can help you. All right?
That's good.
All right.
Also, in light of Thanksgiving being tomorrow, we did a lunch with a doc a couple months ago on gratitude. So that's a really good one to check out. And just, we talked a lot about how gratitude really affects your health, because when you're grateful, when you're working in that positive mindset, it really affects your body. So we just challenge you today and tomorrow, as you think upon gratitude, just think about what you're grateful for in your health, because we're all on our own health journeys, and whether we're feeling great or we're really struggling with some pain, stop to be grateful just for where you're at and where you're headed, right? Because we all have hearts that are beating and lungs that are breathing.
Yep.
And that's something to be grateful for.
Feet that are walking,
Feet that are walking.
lips that are talking, hopefully kissing.
Maybe.
A fun thing we do a lot of times at Thanksgiving is we go around the table and we'll start going around the table and somebody shares one thing they're thankful about, another thankful about, another what they're thankful about, and we just keep on going until we've kind of exhausted the table. You know, you could be there for a while, but it's a lot of fun when you really start focusing on the fact that there's so many things to give thanks for.
To give thanks for.
There's so many.
There's so many.
There's so many.
So many.
Things to give thanks for. To give thanks for. Like today, oh today, that was sent our way, yeah. Like today, oh today, that was sent our way, yeah. Happy Thanksgiving.
Happy Thanksgiving.
Signing off.
Woohoo.